Audio check.
So the way I'm going to start it off with is basically just telling you guys about myself, talk about what I'm kind of doing now, how I got to where I'm at, talk about the future of pharmacy, what cool, exciting opportunities I think are out there, and then I really want to try to leave time for, and the reason why we went over is because I had a lot of questions, so I want to talk, and I like the dialogue, and I want to answer questions and about the things that you'll probably hear today or things that you had before coming to like this event. So. All right, so I think I'll just go ahead and kick it off. So this is going to be the only slide that I have technically that you can see here in person. But what I normally do is I post my slides on social media. So my actual slides I'm going to be talking off of are on Instagram, Twitter, Facebook. So if you guys have an Instagram and want to jump on, just so someone can help me guide through the slides, because sometimes I might ask for some help. Just go. It's at RX Radio is the name of the podcast, and that's where I post the slides if you guys are interested. I need at least one person to do it, so I need, just in case I forget where I'm at, they can help me to the slide. So, you got it? All right, cool. Perfect, appreciate it. All right, so let's jump into it. So, again, a little bit about myself. We'll talk about what's coming, and then what you guys could probably do about it. So, I actually got my career start in pharmacy at UF. I went to the Orlando campus, so that's the connection why I'm here. So, go Gators. Before that, I grew up in Miami, Florida. I went to FIU for my undergrad. I got a degree in chemistry there. And then went to pharmacy school. I was heavily involved on campus. I was vice regent Kappa Psi, president of PLS for a couple of years, president of my class. And I think that involvement is important. And I definitely felt that when I was there. And a lot of the things that I'm able to do now, a lot of that branched from those experiences here on campus. While I was also in school, I had an internship with Target Pharmacy at the time. It was before they were CVS. And then I also was an intern for a company called VUCA Health. And that company creates medication education videos and licenses that to health systems, pharmacies, specialty pharmacies, mobile applications. So the cool thing about that when I was an intern for that company, they were a startup 7 years ago. And they literally asked, like, what students want to, any students want to help create this content. Like 4 of us responded, we all got it. Like, it was just, can you read? Yes? Okay, great. You can do this. So we did. So I was one of those students that did that. With the founders, I was pretty involved in like what the business was doing, where it was going. I was really curious about it. I did that for a couple of years, stopped being a content contributor when they kind of really built out the library, went off into community pharmacy and practice on my own. I then started doing private MTM. So I started an MTM company with just cash patients, no real reimbursement from CMS. And then I started RX Radio, which is a digital media platform that does interviews with pharmacists and writes articles. I have a book out as well. Through that, I really started honing in on the things that I was really passionate about, which is communicating with patients, patient engagement, having an impact on how they understand their healthcare and their medications. So that company I interned for when I was a 3PD about 1.5 years ago basically reached out to me and asked if I can continue operations for that company. So now I'm the president of VUCA Health, and that's my day job. That's what I'm really doing like day to day. The RX Radio stuff, like the memes and all that stuff you guys might see on Instagram, like that's like just things I do on the side. So what I want to do is I want to have a little bit of a conversation about perspective. So the first slide, if anyone's following along on Instagram or Twitter, it says it's the year 1950. Does anyone know what's significant about the year 1950 when it relates to pharmacists? So 1950 was the year that the first PharmD was given out. And why is it? What does that have to do with perspective? The first medical doctor degree, so physician degree, was given out in like 1703. So physicians have had about 250 years worth of finding out what is it that their role in healthcare is. What are they going to be doing? We've only been doing it since 1950. And the perspective of that is 100 years from now, when they look back, every pharmacist in this room is going to be a pioneer of pharmacy, right? People are going to look back and wonder, like, wow, we used to like count medications and Just as how we look back as how they used to fill the capsules and like do like all the compounding, like how it was the majority of pharmacy. People are going to look back and like, wow, they were dealing with the medications. They had to deal with inventory and stuff like that. That's going to be a thing of the past when we really start to find our role in healthcare. And that's what I'm really excited about. And that's why I'm really passionate about pharmacy in the industry. And that's why you're also hearing about a lot of closures and a lot of negative things in the industry about pharmacies downsizing, streamlining, closing stores and things like that. It's on one end of it, it doesn't look good. And I understand that completely. I was in a meeting, I was at NACDS recently with a pharmacy of a meeting that their pharmacy a pharmacy had just filed for bankruptcy and they're closing all their stores. I'm not sure exactly what's happening with pharmacies, but so I'm meeting with some of these people that it's humans that are being affected by this, but it's a reality of a lot of the automation that's coming, a lot of the change in healthcare. So what I want to get into now is the disruptions and what's coming for us. So as we talk about how we used to practice pharmacy and how some of those jobs are becoming less and less available, but there's also a lot of other jobs that are becoming available. We just can't really see it yet. So that's what I want to kind of get into now. So I do believe the next slide is voice and automation, right? Boom, all right, nailed it. All right, so voice and automation. These to me are the immediate disruptors of healthcare. Everything is going to disrupt healthcare. AI, you're going to hear buzzwords about AI, virtual reality, machine learning, and all this stuff. What I think is the immediate impacts and what we're seeing now is the impacts of automation and voice technology. When I say voice technology, I'm talking about like these Alexa devices and like home devices and things like that. As we get more innovative with automation and pharmacists are forced to do other things, well, what's another thing that they can do? When a patient is using an Alexa device in 10 years or 5 years from now, and they say, hey, Alexa, like, how do I treat my allergies? That's going to be an experience that's going to be designed by a human. That human should be a pharmacist that's designing that experience. So there's a part of this space now called conversational design. So it's basically there's humans that are designing the interactions that people have on these voice devices. And the reason why voice technology to me is one of the most immediate disruptors is because of how easy it is to access this device. It's only $30, right? And to use it, all you need to do is know how to speak, right? Which we've all been doing mostly for the most part in this room. We've mostly been talking since we've been 3 years old. So if you hand a patient an iPhone or some sort of tablet and you say, hey, use this, learn from this, it's going to be a very difficult conversation. But if you put an Alexa device in front of that patient, and you say, hey, all you got to do is say, hey, Alexa, and ask it for what you want, that's a whole nother conversation. And because of that ease of use, because of its low cost, and because of the different use cases it has, it to me has the biggest potential to disrupt healthcare. So right now, so my wife is sitting here, being my wonderful videographer, so I can post this later. She can attest to this, that I use my Alexa to help me spell things. Like I'm just not a good speller. Like I just can't spell well when I'm typing and stuff. So I got to say, hey, Alexa, how do you spell this word or whatever, right? What that's going to turn into is really, hey, Alexa, please refill prescription number 45678. And that's going to be where like that technology is going. And there needs to be pharmacists behind that. So whether it be conversational design or just understanding the engagement of these devices, pharmacists have new roles to be a part of that. And we have new ways to utilize our degree with the things that we learn in pharmacy. So this is a good transition to automation. So anyone here work for Publix? Are you serious? And no one here works for Publix in Florida? It's wild. So, oh, there you go. All right. Same thing, kind of similar. All right. So I used to work at Publix Pharmacy, and we had this thing called Central Fill. Central Fill, in my mind, was a facility that had super technicians, just like knew exactly what was going on to fill all these prescriptions and then deliver it to the pharmacy for patients to pick up. So there was no dispensing happening at the local pharmacy. It's all being delivered by that Central Fill. But again, to me, I thought it was just like super techs, like just amazing technicians, just like doing stuff fast. I actually recently toured that facility and it's robots in there. Like when I say robots, it's like what you see on TV about like the car manufacturer arms, and those are huge. These are mini ones, they're like my size, but they're like doing crazy stuff in there, filling prescriptions at a much faster rate than a super tech would, like these, really good technicians would. And that hasn't even really hit scale yet. it's not a huge percentage of what's being dispensed at the pharmacy, depending on where you're at, obviously. But the minute that hits scale, it's going to really free up our time to do why we came to pharmacy school and why we became a pharmacist in the first place. We didn't come to pharmacy school. Like, which class here have you been in that it taught you about managing inventory? One class. Okay. So that goes to show you that it's not what we do. That's not what pharmacists are supposed to do. We're not inventory managers. We're not ones that count. We're not supposed to just be counting pills and hand it to them. We're supposed to take care of patients, educate them about their medications, make sure it's safe, make sure it's affordable, make sure it's effective. These are things that we are supposed to be doing 90% of our time. Instead, we're only doing that 5% of our time at a pharmacy now. So, and a lot of times pharmacy is on defense. We want to hold on to the dispensing and hold on to that act of handing that prescription to the patient because we want to be the gatekeepers of it. But in reality, we need to foster the innovation to allow us to spend that 90% of making sure that medication for that patient is cost effective, it's safe, it's affordable. So that's what we should be doing more of, and we should be welcoming the automation to be able to do that. The other part of that was voice. Who here has an Alexa device at home? Okay. Who here will never have an Alexa device in their home? Okay. So it's super funny that the people that just raised your hand about not having one because you're worried that it's going to listen to you and things like that. But if I yell loud enough right now, "Hey Siri," someone's phone's going to pop up, right? So just so you know, every single device that you have, unless you've actually gone and turned off those privacy settings, it's already listening to you. So if that's something that you're concerned about, just make sure to do that with your phones. But I think about half the room, for those that are listening at home, because I'm recording this audio to post on the podcast, about half the room raised their hands for people that had a Alexa device in their house, and the other half literally was like, "I'm not having one." I think at some point it's going to be 90% of people is going to say, "I have one somewhere around me at all times," whether it be in my car, in my shower, in my bedroom. There's literally going to be these devices everywhere because of the convenience that it's going to provide to you. I can't spell well at all. I have a very difficult time spelling normal words, and I literally will look over, "Alexa, how do you spell weather?" And it'll just tell me, and my wife is sitting right here. She can attest to you that is exactly what happens. It's legit. So just little things like that sort of convenience is going to really innovate and change the way we do things. Now, I asked it how to spell something, but there's companies now that are working, that are testing, this not a theory. They're testing the use case where a patient says, "Hey Alexa, can you please refill prescription number 1, 2, 3, 4, 5?" So everything that we can do right now on our phones is going to be able to be done through the experience of using voice. At some point, it's going to be like that. It's going to hit scale. We might not see it at the end of the year, maybe not even through next year, but in the next 3 years, almost every major pharmacy is going to have a way for you to connect with that pharmacy through that Alexa device. The reason that I bring this particular use case up is because I'm going to eventually talk about niches and what you can do in the profession other than just being the normal hospital pharmacist, normal staff pharmacist. To design the experiences on these devices, it requires a human. It requires a human to, if a patient wants to say, "Hey Alexa, I just burned myself. What should I do?" Or, "Hey Alexa, I think I really have bad allergies. What should I do?" There's a human element to designing that experience for that patient. Who in the world is the best person to design that experience? A pharmacist, right? Most of the people that are designing those things have no idea that a pharmacist is the best person to be designing these experiences. So there's an industry or a segment of an industry in these Alexa voice world that's called conversational design. And I think that is something that pharmacists should really have a role in, because we do that every day. Every day we're talking to people just coming in and we're saying the same crap all the time. Flonase, just take it, it's fine. There's we're doing that stuff all the time, right? So we're the best persons to be in this conversational design aspect of things. And I'm really excited about it. I think, and the thing about the voice device is why I'm really excited about it, especially for patient engagement, which is what I'm really focused on now. The device costs $30, right? An iPhone costs $1,000. So there's a huge price incentive to have one of those devices. Now, to use an Alexa device, all you need to do, or any voice device, I say Alexa, but like it could be Google Home, Apple Home, whatever those things are called. Like it could be any Siri, any device using your voice. To use these things, all you need to do is know how to talk, like, which is the majority of people have been doing that since they were 3 years old. So if you can just, all you have to do is talk to this device and it'll do what you want it to do. There's such a low barrier of entry to using it. And for patients that, like, if you hand them an iPhone, they're gonna look at you like you're crazy. It's a much different experience for them. There's this thing, have you guys been like in your classes talk about social determinants of health? All right, so you guys have heard like loneliness is a huge factor in that, right? Well, if you haven't, it is. So loneliness is something that people are studying now, where they're finding that people who feel lonely, and mostly people in the Medicaid space, like over 65 or Medicare, there's a high correlation with negative healthcare outcomes if they're feeling lonely. And these Alexa devices or these voice devices can actually combat that, because at any given moment, a patient can just say, "Hey, can you please call my daughter?" And then that daughter can be in the room with them. So it feels different than having to go to your phone, like, do things, have it in your hand, things like that. Like having that, just you saying it, and then all of a sudden it's in the room. Like those are little things that can end up combating these things. And again, I think pharmacists are a great way to identify how to solve those problems using some of these devices. So everything that we're doing now in regular pharmacies is being automated. Typing. We talk about like AI and machine learning and things like that. If you think about when you're typing and when you're verifying a prescription, you're looking at this says lisinopril 20, and over here it says lisinopril 20. That's it. Basic high school can do that, right? Like you just have to be able to read to do that. Now, making a clinical decision as to whether they should be on lisinopril 20, it's a whole nother thing. But there's a huge part of our role currently today as it stands is verifying that. That's going to be completely automated, right? So we have to start welcoming these things to allow us to free up the time to do other stuff. So automation is something that I think is going to be, and it's just something we're seeing now. So I got to tour a PillPack facility, and they have, which this blew my mind more than the freaking robot arms. They have a huge, it looks like a huge scanner, right? You guys know PillPack are the little package thingies, whatever. When a prescription gets filled, each package gets fit through a machine, and that machine takes like a high quality image of the medications, the actual pills in that pack. And what happens is it basically verifies it. Like it's using that high quality image, it says this one's good to go, dispensed. The only time a pharmacist gets involved in the verification process during that pill pack thing is if the machine says this is not accurate or something's wrong here. That's when the pharmacist is like, okay, let me take a look at it. All right, what's the next slide?
We're at building a brand.
Building a brand. All right.
Or personal brand.
Yeah, building a personal brand. So as we foster the innovations, as we understand that our roles are drastically changing, the great thing is that there's a lot of people in this room today that can actually create their own jobs, that can create their own positions based on something they're passionate about. With the automation comes the fact that now a community pharmacist doesn't just have to be a master of inventory and a master of operating the dynamics of a pharmacy. It has nothing to do with actually practicing pharmacy. Now we can master educating patients about Humira, about how to inject that medication. Now we can master how to talk to patients about managing their blood pressure and exercise and diabetes. Like there's all these different niches that you can get into. One thing this actually brings me back to as well is, which was really convenient. So I had a meeting actually on yesterday with a large company that's doing patient education solutions. So they basically are doing something where they have a software where they can, when a patient fills a prescription, when that prescription is ready, they can text the patient to say, hey, your prescription's ready, or your prescription's due for refill. Let's say, these are the options that you can do. Should we refill it? Like, do you want to take it? When do you want to pick it up? In that meeting, I was in a meeting with someone that was not a practicing pharmacist. Like they had never had experience working in a community pharmacy. So we're looking through the workflow and we're evaluating like how can this be a better experience for the patient. I, being a community pharmacist practicing in that setting, the first thing that came to mind is when a patient hands me 10 prescriptions and they're like, I know I want all these and these are all good. Like, let's take that. I know that's cheap. I know that's might be, $4 here, but this one, I don't know what this one's for. And it's probably expensive. The fact that the people in that room, in that meeting, did not know that the best idea to add in this workflow was a button that says, I don't know what this medication is for, was like, I just saw light bulbs go off. And whilst a very minute example that scales to every aspect of healthcare. And being a pharmacist really puts us in really great positions to have a role there. And I can't wait till the day, because they're going to be putting that feature into the software. I can't wait for the day that like I'm seeing this in action and I see patients hitting that button so we can trigger another event, which is probably going to be our video with my day job company that feeds a video to that patient to help them learn about their medication, or it'll trigger a call back to the pharmacy to help them understand that. That is one minute example of how important it is what we do and how that can be scaled and utilized in a bunch of different ways. And how things like conversational design are now new opportunities for us. And there's a bunch of other. These are just the things that I'm passionate about. It's not like this is the only thing that's next. There's a ton of others out there. Like I only have like 20 minutes to talk, and this is what I'm the most passionate about. And the reason I just want to give you guys that perspective and understand that, again, we're the pioneers of this, and we really can make a difference. Now, back to the personal branding of that. A lot of people see now, like on social media, they're seeing people like, okay, I got to build my brand, I got to build my reputation and stuff like that. So they immediately build an account, like I'm going to do blogging and vlogging and like do all this stuff. But it's like, that is so much work to do. While you're in pharmacy school, you need to be focused on building relationships with other people that are with you now, because you're not going to get this experience again, really. You're not going to be in a room full of engaged people wanting to do the similar things that you're doing. Take the time to meet and connect with people, and then don't worry so much about your brand, your personal brand. I'll tell you how to do it soon, but I'm just giving you the advice of like what I would do. I didn't start creating content and really building my brand until 2 years after I left pharmacy school. And it's because it's just a lot of work, and you need to focus also on graduating, right? Potentially getting a residency if that's what you really want to do. But really just make sure to build relationships with people. The other advice that I would give myself if I was back in the shoes of being in pharmacy school is to try to find a niche. And when I say find a niche, don't like be 100% of this is the only thing I'm going to do for my entire life. Just find one niche, and if you end up doing that forever, great. But if you end up doing that niche and then you find another niche that you're way more in love with, change it. Like change your niche, like change your passion. Like it's okay. But find a niche, because when you find that niche and you're able to find something that you love or you're passionate about, infuse that somehow with your passion for healthcare and pharmacy, you'd be able to, again, potentially be in a position where you create your own job or create your own role. And it might not be one of those things where all of a sudden you're applying online and it says, oh, patient engagement pharmacist, and like, let me apply for that. And that, boom, your job was created. It might not work out that way. The way it might work is you might get hired on to be a regular staff pharmacist somewhere. And then through the vines, like everyone's hearing about what you want to do in your engagement. And all of a sudden the hospital director comes to you and says, hey, we're looking to enhance our patient engagement solutions. Like, we know you're super passionate about it. That's how your job gets created. And then all of a sudden, most of your time is working on that project, and then you end up moving up the ranks and doing certain things that way. So how do you build a personal brand? So a personal brand is reputation. It's what people before the social media generation used to call a personal brand. It was called reputation. That's all it is. How do you build that? One is through the networking, but it's also through displaying what your passion is. And you display your passion is through either speaking, writing content, recording videos, writing articles, books, whatever the case may be. But creating content is really the key to creating a brand. And I create all types of content. I'm on video now. I do a podcast. I also write articles. I'm doing all of that, and I'm comfortable with it. But there's some people that only should be writing. And that's what you should hone in on and do, right? It's true. And that's okay. It's not, you can build an amazing brand by writing. On the similar sense, some people should not be writing. They should be on video because they're charismatic. They like the camera, whatever, and they can communicate that way. That's what they should be doing. If you can do all of it, great. But if you can't, find the way that you like to communicate and hone in on that when you're out of school and when you have more free time. And that's how you end up building your brand over time. So to wrap up, again, I'm really excited about what the way that pharmacy is going, and having some of the meetings that I'm having now and seeing that there was a culture previously of we have to do what we have been doing before because we have metrics to meet and we have things to do, to see that they're starting to step outside that box because of new leadership coming in and starting to be a little bit more innovative. We're starting to see a lot of changes whether in some of these large corporations that are going to allow for different ways that pharmacists can practice. And again, what I would be doing now is honing in on what it is that I want to do and what I'm passionate about. And one thing that really helped for me when I was right close around the time that I started RX Radio, and I just knew, I'm like, whatever happens to me, like whatever happens in my career, it's going to be at the doing of my hands, right? It's going to be up to me. Like everything is going to be my fault. All the good that's going to come with it and all the bad that I didn't do, it's all going to be my fault, and things that just me taking the accountability to take the career into my own hands. So that was a real stepping stone for me to get into the mindset of you need to start creating content. You need to start honing in on your passion. You need to, just really start exploiting the things that I love to do. And that's why now I have a podcast. That's why now I'm writing articles. That's why I'm here. Literally, I'm only here. Unfortunately, I wasn't paid by the UF to be here. I'm here because this is what I love to do, and I want to really drive the profession, and I want to inspire at least someone in here to do the same. And earlier, I'm not sure if she's in the room, but just someone was listening to the podcast a couple years before she even got to pharmacy school, and it's such a good feeling to know that she's in pharmacy school now, knowing how bad the industry has been, but also hearing all the great things all the interviews that I've been doing on the podcast, to see that there's so much more that you can do with your degrees. And to know that she's here and passionate about that, it's a great feeling. And I'm really, and I'm hoping to do that also when I speak to people in settings like this. Around the time that I was in, I don't remember if I was still with CVS or not, but 2 years ago when I started RX Radio, I knew that I had to start making content to create a brand for myself. And I knew that I wanted to interview and find out what else was happening out in the world. And I realized that to do that, I needed to make content. So that's when I started creating content. And that's when I started really taking a deeper look into what is it that I want to do? What is it that I'm good at? What am I passionate about? And how can I correlate that with my career? And I think that is the key to personal branding, is to really start with the end of what is it that you want to do, and then work your way backwards, and then let that flourish. Now, because of the changes of the industry, and because I had talked about being pioneers, there's people today that are creating their jobs, and there's people today that are being approached by companies for something new that no one ever thought that a pharmacist can be a role in. And the reason I mention that is because that's why having the end in mind for yourself is really helpful, but then also realizing the more niche that you can go in something is the better off you'll be for the most part. And I really think whether it's you love asthma in terms of studying it, become an asthma specialist, become the expert in asthma, because there's so many different things that just an asthma patient needs that a pharmacist can have a role in. If you're passionate about star ratings, there's an organization called the PQA, Pharmacy Quality Alliance, that basically created star ratings. And that's an organization that's today still actively creating measures to figure out how can we better health outcomes, and how can we measure pharmacies and healthcare practices about how to do that. So really start to focus in on what it is that you actually want to do. Now, yesterday, I like to pair things, when I travel, I try to bulk things together. So I had a meeting for my company yesterday with a patient engagement company. I can't, it's not public who we partner with, so I can't say exactly who the company is, but they're a large company that is serving chains, small independents, and large chains as well. They are designing patient engagement tools that can text patients different content and run campaigns when their medications are ready, or if they haven't had a vaccine in a while, they'll text the patient, say, hey, you know, we've seen you haven't had a vaccine for 2 years, would you like to get your flu shot? The individual that I met with, he doesn't have experience working in community pharmacy. And the reason why this, like I was telling my wife, I was like, I'm so happy I had this meeting to be able to have this conversation today, was that there was a clear need for that meeting for them to have a pharmacist in that room. And the reason is because we were going through all the different workflows of like, okay, the patient's prescription's ready, you know, or it's due for refill, and then there's like different options. They can quick refill it, or they can call the pharmacy. What I recommended that they add to this, and it was, I literally saw a light bulb go off. Like what I recommended for this was that you should add a button in there that says like, I don't know what this medication's for. And there's no way that anyone in there, for the most part, I mean, I'm sure obviously someone could have come up with this, but the fact that I'm working at a community pharmacy and someone will hand me 10 prescriptions, ask for the prices, and then say, oh, what's this one for? That, you know, that third one there. And that happens all the time. And it's because that I was a practicing pharmacist that I knew that. These skills are going to be like the skills that you get in pharmacy school, working as a pharmacist, getting that experience is going to be heavily needed in every aspect of healthcare. And we just don't see it, but hone in on what it is that you really want to do and start working towards that, because I guarantee you, like, you'll get to a point if you niche enough and you're passionate enough, like you can actually potentially create your job at some point. And even if like you got hired for one thing, because you're so passionate about the other, you're going to end up creating that job through that job anyway. Bless you. So building a personal brand it's not about building a business. So I think that's also confusing. Like a lot of times people are like, oh, like, you know, pharmacies, like it's going down the drain. You got to have your own business. You got to be a consultant. Like that's total crap, because having a business and being an entrepreneur is not for everyone. It's not easy to do that. And some people don't want to do that. And like, you want to do something that you want to do. So like, don't think that building a personal brand is like building a business. There's actually two separate things. Building a personal brand is the same exact thing as having a reputation. It's basically what it is. It's like, what are you known for? Like when someone hears your name or sees your picture or sees that you wrote an article or did a podcast or did a vlog, like what should come to their mind? That's like what personal brand is. And you do that through content. Now, I think the next slide is, so I'm going to up you on this one, is like, what do you do now? If I was in pharmacy school, now I didn't start creating content for myself until I was a year or two out of, or maybe about a year out of school. I couldn't imagine creating the amount of content I do today during pharmacy school. And I'm seeing a lot of people now that's saying like, I need to build my brand, I need to build my Instagram, I need to like do all these things. Like it's hard, it's work to build a brand and create lots of content. So, but it's not the only way. Like just building and creating content is not like the only way. Again, because it's reputation, what I would do if I was in your roles is I would be making sure to build relationships with people, making sure to attend conferences, be involved, get to know others, because at some point down the line, a lot of these people are going to be the ones that you can potentially make an introduction to get into a role that you created because you were passionate about it. So if I was in your shoes now, I would be heavily focused on, one, finding out what it is that I'm good at or I want to do or I'm really passionate about, no matter what it is. Like it could be anything. And then honing in on that. And then at the same time, building relationships with other people through being involved, through going to events and things like that. Now, I'm in a role now where I've been talking to like like I'm in meetings with decision makers. I was at NACDS recently where there's like VP of pharmacies, pharmacy ops. Like I'm in like some of these high level meetings, and these large corporations are filled with people. And a lot of times we demonize the corporations because of things that they do, but at the end of the day, it's filled with people and people that actually care about you. Like when the Walmart thing happened, I had a district or regional manager like see an article that I wrote about it, and it's like we're so hurt, and it wasn't like a public thing. Like she privately messaged me about how bad she felt about it. So, and a lot of times we're treating some of these organizations like if it's just like some like weird like machine, but it's actually filled with people. So that's just one random thing I wanted to throw out there because I think it's important to know that a lot of the times the people in these roles, they want change to happen. And a lot of times like there's no incentive to be innovative. That's another thing is like when you start looking at these corporations, there's no incentive to be innovative. And a lot of times they know that, you know, the Walgreens on this street should be completely different from the Walgreens on this street because of patient population, but there's a disconnect because of there's no incentive to like actually drive that. And there's actually penalties for like thinking outside of the box and doing some of these things, like because it's whether it fails and then this looks bad on you and like, you know, you could get fired. Like there's all kinds of things that happen there. That's just another random thing I wanted to make sure you guys are aware of, that a lot of these people that when they're in these roles, we think that, are you like, we look at them like, are you stupid? Like you don't see that this is like what's happening here. And it's not that. They're just like, their hands are really tied usually. So just make sure that that is something that you guys are aware of. All right, who has questions?
So when you're talking about like healthcare expanding into the home with these Alexa devices, do you find access to internet being a problem? Because there's still an issue with that in rural areas.
Yeah, so that's definitely a problem. And what I'm finding is that people are actually, I met with one company that have found that it's actually beneficial to pay for the internet to go there. So what people are doing is if the insurance companies are realizing like we need this person connected because we can't reach them and they can't travel and there's all kinds of expenses involved with providing care to them. So some of these people, there's companies that are saying like, we will pay for your internet because we need you connected. So while that is a huge barrier, there are companies that are trying to make sure that those patients get connected because it's just realistically to scale a lot of these things out, that's just what has to be done.
Yeah, that was actually like what I was thinking if that was the case, because I see a lot of like mail order nowadays and almost insurance companies like in a way forcing patients into mail order or forcing them to have to say they don't want it. And so it already seems like insurance companies are trying to get the like to them as directly as possible. So
yeah. And like let's be clear, like a lot of people don't like mail order and you know, a lot of times we're emotional about face-to-face. We need to completely get over that because mail order is going to be at scale, especially with what PillPack is doing. It's not going to make sense for patients to have to come to the pharmacy to get their prescription. We as pharmacists should not, we're so tied to like the dispensing of a prescription and to me, it doesn't make sense because it has nothing to do with providing care. The act of me handing you the prescription has nothing to do with providing you care. Like care that a pharmacist should be providing. And we're so attached to it because again, we're on defense. And we're trying to like you know, hold on to like what we've been doing, but we need to go on the offense and welcoming that innovation to help us do what we really want to be doing on healthcare. Who else has questions? Yeah.
So what's your personal opinion on how they're developing the ability to ask Alexa some sort of question and all you have to know, like you said, is how to speak? However, a lot of times with us being in the field, we know the questions to ask. How do you feel there may be situations that come up where sometimes patients just don't know the correct question? Yeah,
so that's a great question. So part of conversational design is also leading the patient. So a lot of times when there's a skill, which is essentially an app, a skill on these devices, the Alexa will say, you know, how can we help you? Let's just say random. And if the patient says help, or sometimes if the machine learning is just aware that like this patient population is likely going to need some guidance, it'll say, hey, you know, thanks for, you know, asking us a question. You can ask things like, and it'll give examples to that. Now, what some of these things are doing, one company that is actually doing something really interesting, it's not an Alexa skill, but it's a chat bot. So it's called Maxwell, I think. So basically like a patient can text, this is something different, but the use case is similar to your question. The patient can text a couple things and the chatbot is a machine learning thing that's a machine basically answering questions. But at some point it could actually realize that like something's wrong here. And it's gonna actually trigger a notification to a healthcare provider. And then so similarly in a voice space, if the Alexa is just realizing that like this is just not going well, like, hey, hold, like we're gonna get someone in contact with you. And that's when like an actual human would come and like be involved, whether it be through email or call or whatever. So the pharmacy will get a notification. Hey, I saw you were trying to use your device. Like, Mrs. Smith, how can I help you? You know, and like that'll eventually be a part of the experience. So it's a good question. That was 2 minutes of the 15. Yeah, I'll come to you next.
She can go first.
Okay.
So with these new innovations, it seems like there's a lot of opportunities available, like within the community setting and then within businesses and industry. How do you think like something like the Alexa or advances in technology regarding that, where it's more hands-off, would translate into something like hospital pharmacy, where right now it's very hands-on? So
hospital pharmacy, a couple use cases that are already being used now with Alexa devices. From a practitioners are using it. So a practitioner can say, hey, you know, what's the history of this patient's weight? And, you know, if in a heart failure patient, it can see like, okay, that patient actually gained 5 pounds yesterday, so it's a problem. Or, you know, their weight's fine. So little things like that, practitioners are going to start to ask it. And that has nothing to do essentially with direct patient care, like face-to-face or whatever. But for the practitioners, it's being useful. Also still something that pharmacists can be involved in designing. From a patient standpoint, there's one use case. I haven't seen this actually in a hospital, just to be honest. What I've seen is like nursing homes. But what they're doing is they're basically, instead of not actually providing healthcare, but just normal functions like turning off the lights is like important, because if they're bedridden, instead of having to depend on the nurse, can you come turn off the light? Or potentially having to find their little remote to turn off the light, they can just say, hey, Alexa, can you please turn off the lights? Or turn on the TV, like do things like that. So those are little ways that those devices are going to be innovating. Now, one thing I wanted to mention too, I think, actually, sorry, another question.
Oh, okay.
So it's, all right, sorry. Did I answer your question?
Yes, please.
Okay, all right, go ahead. Sorry.
I don't know if you spoke about this earlier, but do you think it's going to be easy for insurance companies to partner up with like the Alexa feature to make it like more accessible for the patient? And if you do see that happening, like how soon do you think that's going to happen?
Yeah, so great question. If I had to meet with a insurance company tomorrow, I would tell them that as a part of their coverage, they should provide every patient with an Alexa device as an option, not just ship it, but like as an option. Say, hey, we're giving you this for free. I don't think there's no barrier to that. And I just think that the way insurance companies operate, they operate on outcomes. So there hasn't been a lot of studies that have demonstrated, like the things that I'm talking about, I have zero scientific proof. I just know it's coming. Like it's obvious though. And a lot of times, like we have to do things in healthcare that's obvious. But when I say we have to, we should, but we don't. A lot of times companies don't make decisions unless there's a proven study that showed X% of improvement in outcomes. And that data isn't there yet. And it's because like the Alexa devices just came out. We're just starting to see the use cases. There's still developers developing the skills to do that. But I guarantee you that there will be a time that, and it's because I'm seeing the results of like of the successes in some of these nursing homes, that insurance companies are going to be providing this to their patients because it just makes sense because of all the things that because of impacting loneliness, access to the pharmacy, with just using the voice. So I definitely see that happening and as the future comes along, where as a part of a patient's coverage, they're going to be able to see that that ability to just get an Alexa for free. Does it make sense? So, yep.
I've seen like the innovation happening mostly when it comes to independent pharmacies, especially like in areas where Puerto Rico. I've seen the robots in their prescription areas already, and they've had apps for the pharmacies to communicate with their patients. How do you see that being transitioned into a corporate setting where you have to go through so many lines of pushback when you're trying to pass technology, especially if you have a very archaic board of directors? Yeah,
so that's a great question. And so I meet with a lot of the exact thing that you just mentioned, my company has a problem with. So even though our company we're not doing robots, our company is doing an innovative solution for some of these pharmacies. And we have that pushback of like, I can sign up an independent pharmacy. Like I'll go to a show and I'll sign up 10 independent pharmacies and they'll just like enroll in our services. But then it'll take me 2 years to like get another chain on board. right? And it's the same product. And the reason that is because of all the bureaucracy that you mentioned. What's the things that I do and what needs to be done with these organizations is that they need to look at startups and look at why startups are effective. And startups are effective is because there's an incentive to fail. And what do I mean by that? There's an incentive to try as much as you can to figure out how to make it work, no matter what it takes, whether it's failing or not. Obviously, you just can't go out of business, but when you're in a large corporation, there's no incentive to fail. It's like, we need you to do something, we need it to work. And if it doesn't work, like, you're borderline out type of things, or like, this is going to be a problem. And that's a bad incentive to have in these corporations. And the reason for that also is because there's short-term incentives that these corporations have, like they have to meet numbers and metrics and that kind of thing. So they just hone in on like what is either already working or what there's like scientific data behind. But the culture needs to change. It needs to change here. Like, someone in this room potentially at some point is going to be a leader in one of those organizations, and you have to have that mindset of being like, it should be run like a startup. Like, we need to try new things, especially if it just makes sense. Not because like there's a bunch of numbers behind it. It's like, it just makes a lot of sense. And then if it fails, like, it should be incentivized of like, hey, you went with your gut, you called it, like, you know, and the next one that you do is probably going to work. Or we learned so much from that failure, and now look, we're implementing X, Y, Z. So I think it's just the mindset and the conversations to have with some of these organizations when you get to like a point where you can talk to them. And again, to the earlier point, like, a lot of times they know what is coming. They're just not willing to put their neck out on it as well. So I hope I answered your question. Okay.
Okay, so I hear a lot about advancements within, like, for pharmacists,
Mhm.
within pharmacy operations, and then the advancements with, like, patient care.
Mhm.
But do you feel like the personnel, like the technicians, do you see like they'll be eventually phased out, or are you aware of any opportunities for advancements in their role?
No, I think on the contrary, they're being trained more. So what's happening is there's some states now where technicians are providing immunizations where that's legal. Because of the things that I mentioned before, where it's like pharmacists are required to do these, like, you know, matching words like lisinopril 20, lisinopril 20. There's also states that are doing like tech is what you call it, where a technician does something and then another technician comes and checks it, and then it's verified, it's good to go. It's usually like on refills and stuff. But I think on the contrary, that most organizations are trying to figure out how to utilize technicians more. And the reason is because you know, they're not as highly paid as pharmacists, but they can do a lot of the things that the pharmacist is doing, right? And that's also a reason why we need to like not hold on to those things, because it's just pointless to. If someone that just has a technician training can come in and do that role that they didn't have to go to pharmacy school for, we shouldn't hold on to that. We should allow that to happen, and then figure out a way to better use the skills that we use. Like, the community pharmacist loses, unfortunately, unless you're a ninja, like, you're losing a lot of information because you're not using it. It's not because you don't want it or you don't like it, it's just you're not using it. And we need to get to a point where the majority of the time that we're practicing pharmacy, we're using the skills that we develop in school. So I think you had, and then I'm gonna go here and here, my peripheral vision.
So, not to be a downer, but
Mhm.
like, more I hear, more I'm imagining, Lexus, whatever the thing, becoming like Jarvis, where you just ask it a question and you will know like every answer possible. So you will be undoubtedly better pharmacist than I am with the knowledge, because it's a machine, you will never forget.
Yeah.
So
Well, Google is a better pharmacist than you are.
computers entirely, because pharmacy is not needed anymore. Because if I'm a doctor, I don't have to ask a pharmacist, I just ask Jarvis.
Yeah. So the thing about these decisions, like, information is becoming commoditized, right? Every pharmacist has a LexiComp or the equivalent in their pocket. Google, like, you can find legitimate medical answers on Google. That's already there. That's already happened. There's no going back from that. Even if you look further out, Elon Musk has created a company called Neuralink, where they're creating a brain-machine interface, where they're putting a chip in your brain that can essentially give you access to everything, right? When that happens, you're still going to need a pharmacist, or you're still going to need a specialist to clinically make a decision that requires emotion, that requires critical thinking that utilizes the information. We have to get to a point now where we understand that the information, it's not what you know. And this is starting to actually go to to networking as well, where like everyone's like, oh, it's not what you know, it's who you know. No, that's not even the case anymore. It's what you do with who you know, right? And the same goes for the information that we're all going to be getting access to. It's not about that we can get all the information. Anyone could at some point get all the information they need, but what do you do with that information? And that's why the pharmacist is still going to be needed like throughout all this and all the other practitioners. So I think you had one?
Yeah. So community pharmacy, and I know this is a digital health presentation, you're saying it's moving towards mail order, and it's becoming digital, right? So I joined pharmacy because I wanted to make an impact on patient health, having that one-on-one. And we're taught in school, and what we learn from not even being in school is that we're the most accessible. A patient can come and do those things, right? So if you have a robot fill prescriptions, central fill, what have you, mail order, then what is the pharmacist doing beyond giving, which is their job, the consultation, right?
Sure.
So remove all those things, and what you're left with is consultation, right? What's left now for community pharmacy in terms of their role?
I didn't apply to residency, right? Because I was so passionate about community pharmacy. Like I wasn't like I didn't get it, and like I didn't think I would. I loved community pharmacy, and that's what I went into. And I went into it because I wanted to change it, right? And it's because everything that you just mentioned, I wanted to try to figure out how to execute on at some point. And what's left is notice the community pharmacy, you don't get any of that training through school, all the 4 years. The only time you do is when you do an IPP or the APP at the pharmacy. Everything else in terms of operating the pharmacy, you're not doing in school, right? So what you're going to be able to do is now execute on all the things that you went through, whether it be talking to a patient about social determinants of health, figuring out what's going on, connecting with them, motivational interviewing, like all those things that you actually learn through school is what is left, and it's all that we should be doing, right? So what's going to be left is technology to enhance that. So at the time that there's a patient not coming in, so there's a company, you guys can all look this up later, there's a company called Aspen RX Health. They're basically creating the MTM for Uber, or the Uber for MTM, right? So like what they're basically doing is they've created a platform where a pharmacist sitting anywhere, whether it be at home or at a pharmacy, can just look through a queue of patients that need MTM services completed on them. And then from the queue, they can do the service, and then they get paid right there on the spot after they obviously document and do all the regular MTM stuff. So the pharmacist should only be doing that stuff, right, throughout the day, not like doing all the other stuff that's involved. And that's what's left for us to do.
So in terms of that, sorry, I think this is my main question then.
Sure.
So if the bulk of community comes behind filling prescriptions, however many prescriptions you fill is how our company makes money. Does MTM then, which is what is left, does that make money?
Oh yeah, of course. So we're not making money off regular prescriptions anyway. Like that's why do you think flu shots have become such a huge thing? It's one, yes, obviously we want to make people healthy and not get them the flu, but the profit margin on a flu vaccine is insane compared to lisinopril, right? And all these different revenue models are why these things are happening. We have to figure out that we have to understand that the dispensing part is not how we're going to be making our money in the future. It's going to be these services. It's going to be partnering with a telemedicine company. I just interviewed the CEO of MD Box. It's going to be posted on Sunday. That company is basically creating a platform where every single community pharmacy can have a virtual minute clinic at it, because a patient just shows up and says, "Hey, I want to. I think today I might have the flu," and then they could get on a call with the doctor or whatever, like just through the phone. The pharmacist can perform the test just to see if it's negative or positive. Prescription gets dispensed right there. Boom, you're out. Not only did you make money off the prescription, but you also made money off the telemedicine consult. So those are different revenue models that are going to be put in there. But the whole, we're going to make money off of this prescription, and that's how we make money, is going to be completely gone at some point. Okay, who has questions? All right, in the back.
First off, thanks for being here today. We appreciate it.
Thank you.
So what you touched on earlier, basically we go through legislative days every year, and there's often a bill to propose to empower technicians to kind of do more roles of the pharmacist. I've kind of been in the mindset that to grab the next branch, we kind of got to let go of the last one, and I kind of feel like that might be the vibe you're giving off. Do you think we should kind of be more active in that, kind of like supporting like technicians to take maybe some of the more tedious tasks so that we can kind of get those dream jobs that you were touching on during the presentation?
Yes. So this is a clear example of the pharmacy being on defense, and the fact that we need to go on offense. So we're again trying to hold on to, and part of it too is liability. A lot of times pharmacists don't want to give a technician a role because they think if they mess up, it's going to be the pharmacist's fault. When that's also changing with some of that legislation that comes. We have new things where they're doing check versus check, tech. It's a hard thing to. They're doing these things tech, where basically it's usually on refills, but a technician fills medication and is verified by another technician. If something goes wrong, that's the technician's fault. Even though there's a pharmacist there, that liability is still not fully solely on that pharmacist. That's going to be on that company and the technicians, not on the pharmacist. So again, this is an example of just us being on defense and us needing to. One thing that I mentioned earlier today that in terms of automation, right, be on defense. A main role of a community pharmacist is verifying that a pill matches another pill, right, or an image, sorry, or that words matches words. So if you're verifying, and I know you guys may not have seen this, but when a pharmacist verifies, they're looking at the prescription that says lisinopril 20 milligrams, and they're making sure it was entered as lisinopril 20 milligrams. That is a huge part of our role as a pharmacist. And you're just matching words. Like, unfortunately, you're just matching words. This is nothing to do with clinical. Like, should they be on lisinopril is a whole nother question, right? But the fact that you're just matching words, that's going to be automated at some point. Machine learning and things like that, that's going to take over. I toured the PillPack facility last year, and I was looking at all their operations, and I saw that one of the way that they verify the package. Everyone's here familiar with PillPack, pill packages, medication side. They feed those packages through a large printer. The printer is like the size almost of this table here. They feed each package individually. This size of this is some super high intense camera, essentially. And that camera takes an image of that picture and has some sort of AI or whatever that figures out, is that the medication that's supposed to be in there? The only time, and that's verifying that prescription. The only time the pharmacist gets involved is if the camera picks up something weird. So, or a problem or an error. That's the only time the pharmacist gets involved. Other than that, the packages are being verified by that machine. And that's freeing up the pharmacist to do other things. Right, so PillPack has a team of pharmacists that are just making care calls and making sure like the care is being coordinated, doing MTM and stuff like that. And that's because those machines provide for that extra time for those pharmacists to do that. It's a prime example that we should be fostering, whether it's technicians being able to have more roles that don't require them going to pharmacy school, or machines doing more things for us that also can do the job better than we can, and it has nothing to do with like our needing to go to pharmacy school. We need to welcome those to allow us to perform the duties that we're really here for and what we should be doing.
Thank you.
Sure. You first and then you next. Okay. All right.
Hi, also, thank you for coming. I also listened to your podcast.
Oh, thank you.
Big fan. So with you saying that, you think that pharmacy is going to be changing and the roles of the pharmacists are going to be changing, how do you think that's going to affect like academia, like the curriculum and what types of prior education you would need, and have you ever considered academia?
Sure. So luckily for the business of schools, you have to have a degree to be a pharmacist, right? So which is unlike other schools. Like there's times where people are going to business school to do business when you don't need a business degree to make a business, right? But you need that for pharmacy. We need to know that you know your stuff, which is an absolute requirement. I'm a firm believer that the academics of it is going to change. What I'm starting to see more of now, but what we're not seeing is that everyone's attention is changing. So the way we consume information is changing. And what I'm seeing now is there's pharmacists that are building content on Instagram and doing things like that, and people are learning. Literally, people are scrolling through their Instagram feed and learning a quick pearl about smoking cessation. That's amazing. And I think that incorporating that sort of education and being able to engage the way that new students are learning is the way that we should be moving towards, and making sure that they're being engaged. Because at the end of the day, like, it's really up to the student to learn this stuff, and it's the teacher's responsibility, obviously, to present that information. But the great educators and the great teachers are the ones that are actively involved in engaging their students and getting their attention where that attention is. So I think that as we start to as things start to change that way, and the pharmacists, like the ones in this room, potentially one day will go into academia. They'll be able to interact and engage and get their attention and help them learn and inspire them to be better pharmacists. In terms of if I would be interested, I mean, that was never like my end goal to go into it, but I do it every day. I'm just not attached to a school. All I want to do is help people learn and teach them things. I'm just not an expert clinician, so I wouldn't be in the role of, helping someone become an expert in endocrinology. But hopefully one day I'll be able to help expand pharmacy's digital health knowledge and the use cases of digital health, how pharmacists can play a role in all those different use cases. Talk to them about marketing. One thing that's actually very underutilized in pharmacy is the fact that we're actually amazing salespeople. The pharmacist that loves to interact with other people and can potentially have a sales role is amazing because we're not salespeople and that we're pharmacists that just care about the patient. We're actually amazing salespeople. And I'm just seeing that firsthand as I'm now responsible for growing our company and growing our business. I'm technically out there being a salesperson, but I'm not doing the car salesman type tactics. I'm actually genuinely trying to help patients with what we have. And it's a skill set that pharmacists have, being a community pharmacist especially. And if you have the personality to be in sales without any sort of formal sales training, you're actually already out the bat with a PharmD and an amazing salesperson. So maybe like one day I'd be teaching that at school, like to a pharmacist. I don't know. I don't think count on it. Yeah. So, good question though. Oh, sorry, you were next, and then you. And then back.
This might seem like a random question, but I heard that the field of pharmacy informatics is a growing field.
Nailed it.
What do you know about that field, and how do you feel like it can contribute to pharmacy in terms of automation?
That's a really good question. So, pharmacy informatics is. I recently interviewed the host of another pharmacy podcast that is solely focused on pharmacy informatics. That podcast is called Pharmacy IT and Me. The host is called Tony Dow. He's a really good guy. He's a pharmacist out in California, and when I had a conversation with him, one of my questions was, "What the hell is pharmacy informatics? Like what is that?" And his answer was, "It depends on who you ask, right?" But essentially, it's a huge growing field, and it's a great bridge between healthcare and technology. Pharmacy informatics is really the bridge to fusing those two things together, and it's a huge growing field. And there's a lot of opportunity. They have PGY2s now that have residencies specifically in informatics. They have positions where literally the title of the pharmacist is informaticist. So that's definitely a growing field. The problem is like, what is it? Which you can find, and I think that podcast is actually a great way to start, or reaching out directly to Tony. That he'd be able to kind of guide you. There's also groups. There's a Slack group. I don't know if you guys have heard of what Slack is. It's basically like a forum in like the new business world. That it's been around for a while, but it's just becoming, I think, more popular, especially with healthcare and just random groups. But it's kind of like a Facebook group, but there's a Slack channel. It's a pharmacist Slack channel that all you need to be is a pharmacist intern to join, or a pharmacist. And there's actually an informatics group where there's just informatic pharmacists in there just talking, like posting stuff, talking. So it's probably a good thing to get you introduced to informatics. Yeah. I think there was one in front.
Yeah, so I think I've seen that one of Luca Health's goals, like to go paperless pharmacies.
Yes. Nailed it, man. My marketing's on point.
How's that progressing, or how close is that to being full reality?
Sure. So thank you for asking that question. I appreciate it. So we have a campaign that we've been going to boards of pharmacies to advocate, because when we review the pharmacy regulations, most regulations don't say that when a patient gets a prescription, you have to put all that paper in the bags, whether it be a med guide or just a patient ed sheet. There's actually no real regulation that says it has to be on paper. So we don't automatically just assume that's the case. We actually go in front of the board and say, "Hey, board, we've reviewed the regs and this is what we found. Can you confirm this?" And we've gone 44 states so far to say, yes, that's actually true. If you can provide the med guide and the patient ed sheet digitally, and we do it through a QR code on the patient's label, the pharmacies don't have to print that paper anymore. So we've been saving pharmacies a lot of money just from directly from like improvements in workflow and not having to print that paper, the pharmacies have been saving a lot. And then a lot of times when patients come to pick up their prescriptions, they're like, can you just throw the paper away, please? Or you end up fighting in the parking lot. So, this is a way to just reduce that waste, but then also that paper, that QR code not only comes with the med guide that's digital or the patient ed sheet, but it comes with the video that we created specifically about that medication. We're in over 500 pharmacies across the nation right now. I think we have at least one pharmacy in every state, although some of the states that are not approved, they're just not going paperless. They're providing the digital access. But yeah, Florida is the state that has the most pharmacies. But yeah, we're in over 500 pharmacies across the nation so far. So I think there was a question towards the back. I saw a hand. No? Okay. Anyone else has any questions? We have 14 minutes.
Can you talk about a little bit more about your time at the University of Florida?
Yes. So, just like when I was a student?
Yeah, when you were a student.
Yeah.
Orgs and fraternities.
Sure. So, I would highly recommend getting involved in something. I was in Kappa Psi, but I don't care if you join Kappa Psi. Like, join something and be involved. Have a position. Have a role. There's one thing that I think was huge for me to learn in this was the difference between a leader with a capital L and a leader with a lowercase l. So big L, little l. It's just, I don't know who made this up, honestly. I just remember it like sticking with me. The leader with a capital L has a title. It's bless you. It's treasurer, vice president, president. That's a capital L leader. They make decisions with getting stuff done. Then there's the little L leader that is supporting all that. That is on the back end, making sure that they are there to help make things go smoothly or support that big L and doing things. And I think learning that dynamic in an organization, I think was really great. And I think you get that by getting involved. Getting involved for me was, other than obviously getting the PharmD and the education, was probably the best thing I think that's helped with my career, because it helped me just understand the dynamics of like working on a team, solving problems, how just the dynamics of how like the chain of command works in organizations, the politics behind a lot of that. So I'd highly recommend that. And then also going to events, I think was really helpful as well. And that's mostly for the networking and the building of relationships part. I thought that was a really helpful thing for my career. And then now it's also great because now I can also help others that need help in that, and because they know what I'm doing, they can just reach out to me, and because I've met them and I know them and we had a great relationship, I can help them in any way that I can. I do that obviously for people that I don't know as well, but it's a helpful thing to do. And I went to the Orlando campus, so I don't have much, and I think you guys are all Gainesville, right? Yeah, so it was definitely obviously a different experience there. We had a smaller group, but yeah, I think just getting involved, I think, was probably the best thing that I think that was important for me in the organizations, and I think it's helpful as you, and again, whether it be not because you have to run for an election and get voted in, but just being involved and just being a part of those organizations. So, yeah.
What are your thoughts on like provider status, I guess, for future pharmacy?
In terms of like if it's going to happen? I think it's definitely going to happen. I wish I could tell you when. It's funny when I hear when you really talk to people that know how much we know and think how stupid it is that we can't prescribe something. What I think is a great thing that we're seeing is the action in other states where you already have pharmacists that are prescribing birth controls, prescribing other things. There's also a large movement that people have been engaging in collaborative practices. I mean, that's the real big loophole, where you basically connect with a physician and say, hey, physician, can I prescribe this list of things if these things happen? Prescriber's like, yeah, duh, go ahead. And that's how you end up forming those. But I'll also be honest in the fact that like my strong suit has not been on the legislative front of things. It's been engaging with, figuring out how to engage with patients, how to help them through digital health and things like that. So I'm not going to pretend that like I'm an expert and say that these are the steps we need to do. And when that happens, I'm just not in that space. But from a common sense standpoint, I think it's definitely going to happen. I just don't know when. And I also know that whether you want to be on the forefront of leading that legislation, or you want to be like how I am, where I'm not on the forefront, but I'm just executing on all the things to be ready for it, that's what you should be doing, is either being on the front lines of pushing that legislation, or if not, automatically assume that at any given moment you could potentially start prescribing things. That's how your career should be centered around. No problem. So I don't think anyone on this side answered a question except for the gentleman in the back. You guys got nothing? No? No questions? She's like, no, I don't. Oh, Kavanaugh, thank you.
So I want to ask what you think about, we're talking about networking and collaboration. Oftentimes we think about it within our own sphere, but as on healthcare teams, we're going to be interacting with other people. Sometimes there's some territoriality when you're talking about provider status. And so just talk a little bit about your experiences with collaborating interprofessionally.
Yes. So an episode that's going to be posted on Sunday was with the CEO of a company called MD Box. This person is a practicing physician that went to Columbia Medical School and did a residency at Harvard Medical School, which is, institutions that are highly regarded. One of the main points of our conversation was his love for pharmacists and how impactful pharmacists have in healthcare. And the reason is because of kind of similar to what we've talked about in terms of like where the craft that we do, like what we came to school for, is making sure medications are effective, safe, affordable, and the right ones for that particular patient. When we're the experts of that, every other branch of healthcare needs us, just as how we need them as well. We need the nurses to do what they're doing. We need PAs. We need the physicians. We need them as well, but they also need us. And I think that understanding that and humbling ourselves to know that we are the experts in that, but not having to have it be verbal, I think is a huge part. Because a lot of times, we want to be like, you better call me doctor also, like that type of mentality. But like, again, that also kind of goes back to like big L, little l, right? If we can be that little doctor that's like, providing real care in a real way where we're supporting, they think we're supporting, we're really driving the whole thing. At some point they're going to be able to realize that pharmacists, we need you on our team. So I asked the physician, I said, hey, like, if you had an unlimited budget, what would you have, like who would you hire? Like what pharmacists would you hire? He's like, I'd hire like a bunch of pharmacists and I'll have them doing care plans, safety. Like and I did not prep him for this question. Like I wouldn't say, hey, I'm going to ask you this, so be ready for this. I off the bat thought about, hey, if you had unlimited budget, what would you do with all these pharmacists? And he had answers like off the bat. Us realizing that and understanding that and being able to execute on providing that care in a team, I think we'll be able to foster those relationships with collaborating with other physicians and other dentists, PAs. They need us, and it's just us realizing and not needing to be boastful about that, we're a doctor too, I think is a mindset that we have to try to get out of. And it's not to say that we don't deserve it. I just think that sometimes we go over the top and it hinders our ability to collaborate, when we want to be fostering that ability to collaborate. Hope I answered your question.
So we talked about a lot of really innovative practices for pharmacists, but I was wondering how you respond to those, especially in our own field, who maybe aren't as open to those things, like those who came before us, and kind of getting them up to speed on where the profession is heading.
Yeah. So a couple years ago, I wrote an article titled Amazon's Pharmacist. And this was before they even acquired PillPack. This was before, we even knew that Amazon was going to buy PillPack and PillPack was even going to be like a pharmacy for real. And in that article, I detailed out the vision and the future of what I think a pharmacist is going to go towards. And I think that having the conversation with them, that defense offense conversation, and then also when the things happen. So it's cool now that I had that article written a couple of years ago, and then Amazon bought PillPack. I'm like, you see, like this is going to happen, like this is what's coming, and you need to be ready and innovate for it. So a lot of times it's having the conversation, but also being able to show them what's happening, like actually say, this is happening. Or did you know, so MD Box, the recent episode that I did, they're creating a platform that allows basically a virtual minute clinic to occur at any pharmacy. So whether it be an independent pharmacy or a chain, a big chain, a patient shows up to the pharmacy and says, hey, I think I have, my throat's really hurting. Telemedicine visit. They hop on an app. The pharmacist is there to support any sort of diagnostic needs that need to be done right on the spot. And then the pharmacist also gets billed or can bill for that telemedicine visit. I don't the specifics of that exactly, the semantics of that I don't know, but somehow the pharmacy is making more money off of that telemedicine visit. So just showing them that these are the things in the future that's coming, and also realizing like you guys are not making, especially the independents, the community pharmacies, you're not making money anymore on dispensing. That's not where that's why the whole flu vaccine, like, while yes, obviously we're healthcare providers, we want everyone to have the flu. The reason why the corporations push it so much is because it's such a bigger profit. It's way more profitable for them to sell, to vaccinate someone versus provide them metformin or give them metformin. Just way more profitable, like over like hundreds of percentage more profitable. So that's why it's pushed so much in terms from a business standpoint. Obviously, like, we know vaccines work. We want people to get them and stuff. So it's a win-win, but it's just showing them that these are the things that are happening and that this is the future and this is how you need to innovate. If not, you're going to end up not winning. So that was a great question.
We're seeing things on social media about pharmacists talking about like, trying to unionize and creating unions.
Oh my God, that's such a good question. So I have a draft of an article right now about unionizing, and it's not in support of or in opposition to. The article details out when we think about unionizing and we think about we look at the physicians, we go look at the AMA. We would never allow that to happen. They would never allow that to happen. Like why can't we do that? Why can't we come together? I found the AMA's, which because this is public information, I didn't steal it or anything. I found the AMA's spreadsheet or balance sheet as to the funds that they take in from their members. It's like $300 million. The APHA was like $24 million. So we're trying to compare the power of just the APHA. Like a lot of times, I mean, I'm not picking on them. I'm just saying that this is what people normally look to. We're trying to like expect the APHA to do something that a powerhouse making hundreds of millions of dollars is doing. And then we think, oh, we should unionize because that's the answer. But unions charge you like 2 working hours a month as your union fees. So what's going to happen is if we do unionize, let's say, and again, I'm not advocating for it because there's a lot of reasons not to unionize because there's people have arguments that it's actually bad, and there's obviously people that have arguments that it's good. So I'm just providing the facts here. If we unionize, we're going to have to spend 2 working hours. It's either every 2 weeks or a month. But either way, it's like $100 a month. Let's say every month you have to pay for that union to support and advocate on your behalf, which in turn is going to get to that point where we're like the AMA and we have all the money and the power to make things happen. So what I think we have to realize is we have to do something, whether it's unionizing or whether it's just supporting more of what we currently have in place. We need to do something and we need to pay for it because that's the only way it's going to really have action. Unfortunately, it's an unfortunate situation that the way our politics work, the reason why we're not prescribing is not because we don't know how to, it's because legislative, like through legislation, we can't. And that's all through lobbying and money at the end of the day. So until we can understand that we need to have funds to drive this lobbying and to drive this to not let it happen, we're not going to see any change. So whether that happens through a union or not, that's up for debate. But I just think that we need to understand that we're going to have to start paying for that. Sure. Did you get one more? Yeah.
So I was going to ask, I'm pretty sure your day varies on a day-to-day basis, but can you take me through an average 9 to 5?
Yeah, so I can more so give you like a week. And the reason is because every day is different. So one day, so I mainly work from home. That's mainly what I'm doing. So one day I'll have our business ops meeting, which is just a virtual call. And then I'll maybe have scattered meetings throughout the day with other companies that I'm either supporting their account because they want to talk about how they want to expand their license or how they want to use the videos a different way. Or I'm meeting with potential new customers that say, hey, we're really interested in your videos. How can we use them? I'll have a meeting with them there. The day after that, I might travel to a trade show to set up a booth for our company that will, again, try to expand more business. the day after that, I might fly to a headquarters for a particular chain or a company that's already using us and have a meeting there as a business review. And then that Friday, I might come home and then probably recap on emails and just like catch back up. And then some of those nights or on that Friday, I'll probably record a podcast and then edit the podcast over the weekend and then have it posted on Sunday. So that's kind of like a typical week for me. And I'm always on social media and Twitter. Like, unfortunately, I'm probably on social media more than like most teenagers. But the difference is like, I'm not on there just like consuming and scrolling. I'm on there creating and building my brand and community and like sharing things that are going on in the industry and things like that. So luckily it's a little bit more productive than a teenager. But I'm on there a lot. So
then kind of follow up. That sounds like a pretty cool job.
Yeah.
What would you recommend to students kind of wanting to really mimic that or try to kind of do what you do right now?
So a lot of the roles that end up being in leadership, like beyond just community pharmacy, a lot of times they're either in an office or they're virtual. A lot of companies are moving to having positions where most of it is virtual. But you really get to these roles when you, again, kind of hone in on what you're good at, really start to network to end up creating your job. And that's how you get to that. Now, there's some people that cannot work from home. So that's another thing. Like, you also have to know, like, do you want to work from home? Because it's not easy. Like, it's like you have to stay motivated. You have to stay on top of things. You have to deal with like lawn people coming, like, you know, just like messing up, you know. So there's all kinds of like distractions that can happen there. So you also have to know too, do you want to do that? Or are you going to be more productive where like my work doesn't leave me? I feel like I work all the time because I'm working from home, right? So it doesn't leave. But some people want to go to a place, do as much as they can, do what they got to do, and then go home and just like, that's it. So you also have to like internally think about what it is that you want to do and how you want your career to be. But as you start to come in some of these more innovative roles, it ends up being where it just makes sense for them not to have the overhead of having an office to have you sit in that office. So the higher up that you get, a lot of times it ends up being that way. The meeting I was at yesterday, they voiced in a similar setup. They just voiced in someone from Texas. Like, they didn't need to be in that office there. They could have been doing that from home. But yeah, so. All right, I think my time is up. Again, I thank you guys so much for all your attention. You guys have a good one.